Hello and welcome to the Auditing Antics podcast. So Michelle, we're happy to have you back today. I've said on the past couple of episodes you've been taking a little bit of downtime and you're feeling a lot better.
Yes, and hopefully I continue to do
Yes.
that trend upward. It's no fun when you feel exhausted all the time. So,
Yeah, exactly. Well, we're happy to have you back and I'm back from vacation. I still feel a little foggy headed. Um
oh, so
hopefully
so sad.
hopefully I can form words today.
Goes to Hawaii, leaves me with her teenage daughter.
Exactly. Michelle got to um, parent the teenager for a couple of weeks, and along with mom and dad. And yeah, I
She
got some
wasn't too
downtime.
bad. It's like getting her to spend time with you is impossible.
Yeah, that's the worst part is getting her not to hibernate.
Yeah, that's what she did.
Yes, exactly. All right, so today we're going to kick off the month of May with mental health awareness. So, this is something that I hope people that have listened to us long enough at this point really recognize the fact, Michelle, that you and I are pretty open about our own struggles,
Yep.
about advocating for work life balance, taking care of yourself in all areas. And this really is going to take it up another level today because I want to talk more specifically and not even necessarily in relation today to medical coding and billing, for example, but I want to talk more specifically about mental health and some of the things that we've been through. We've got some family things that have happened pretty close to us, and I've dealt with a lot of things over the years, and I just want to take a moment in the beginning of this month to really focus on why it's so important to talk about it and
Mhm.
why it's so important to tell our stories to hopefully help other people.
Yeah, I agree. I think that oftentimes these types of feelings like anxiety or feeling depression are something that people don't like to talk about. They can be deeply personal, but I think there also comes along a certain amount of fear of how you're going to be perceived in the workplace if you speak up and say, "Hey, I'm struggling with this. Can we do this for a little bit to try to, help me just get through this time where I'm having some struggling?" And so I feel like people don't feel they can talk about it or don't want to talk about it. But you
Mhm.
have to be able to have a way to not keep that all bottled up all the
Right.
time because it does nothing for you. It just makes it worse.
Yeah. And sometimes, to that point, there will be people who say, well, this is not a professional outlook to have on something, to be open about a struggle or things like that. And really, that's just not the case. I know that
Mm-mm.
there's that mindset out there. You and I have talked quite a bit about our upbringing in a pretty strict religion that has its own viewpoints on mental health and how, frankly, that can be harmful in certain
Very
situations.
much
So,
so.
it's really important to talk about this on a personal level, but also working in the healthcare industry and having that religious background. I think it's important to talk about it from a science and a medicine perspective as
Yes.
well, because
Yes.
it's not just a spiritual thing. Mental
Mm-mm.
health is not you being, possessed by demons or something like that, which I know is
No.
funny, but that
No.
is the reality of how a lot of people are putting, a stigma on this particular area
Like
or
you're
illness.
you're the problem because you're struggling. And that
Mhm,
is 100% not the case. A lot of times these are not things that we have done something that has caused us to have this mindset, or it's not always even just I don't like the word mindset because there could be things going on with you medically that need to be
mhm,
addressed that are resulting in how your body is feeling and how you're thinking about things and responding to things.
mhm. Yeah, very true. So I pulled up, I wanted to look at some statistics for this month just to understand, on a higher level, what mental health looks like in the US alone. So what I pulled from is the National Alliance on Mental Illness, and they have some statistics here that more than 1 in 5 adults experience mental illness. More than 1 in 20 US adults experience serious mental illness, and more than 1 in 7 US youth ages 6 to 17 have a mental health disorder. And this is broad, this is looking at the US as a whole, but it also makes me think about the healthcare industry,
Mhm.
because when we think about the clinical side of the industry, there's a lot of stress, there's a lot of pressure, not only from what's being done within medicine, but if we think about the administrative pressures, which in
Mhm.
our positions that compounds as well, we
It
feel
does.
some of that. But we've talked before about how, what our focus and compliance is and how that can add in stressors as well. And, I didn't take the time to dive deeper into mental health specifically in the healthcare industry, but it's an important area. And we saw a lot of that come about during COVID, where, nurses, physicians, different practitioners really struggled with that side of things.
Mhm.
And, there was a lot of unknown at the time, and I think the unknown component can be very difficult as well. And
Yeah.
I'm still seeing that at this point. Earlier this year, and, I'm not going to go into too much detail here, but earlier this year, I did have a client that I was working with who was going through a pretty stressful situation with CMS and the case that had developed and things like that. And that particular physician did die by suicide. And it gets me thinking even more, because when we think about, the fact that we shouldn't have the different stigmas, we also have to think about the fact that mental health does not discriminate against the people that are experiencing it and struggling with it.
Mhm.
And you could be of any background, from any culture, from any profession. It doesn't just look at those that are homeless on the street or a drug
Mm-mm.
addict, something like that. It really is something that can hit anybody, and it could come from nowhere. A lot of people do have underlying things that they're battling, but it really can come out of nowhere where you feel this pressure and it gets really hard to tackle that by yourself.
Yeah, and I think that is the most common for for me in my experience with mental health. I tried to just keep everything all bottled up and until I couldn't anymore. So I feel like when we, or like when we finally learn somebody we know is struggling with that, it's like, wow, I didn't know. And that is what can be so unsettling about mental health is we see that Facebook, perfect Instagram, perfect presentation of people. We see the smiles, we see the laughs, but what we don't see is what's going on behind those smiles and laughs. And often, if we knew, or if we just try to be a little more cognizant of people around us, um, we might be able to see and help before something like that happens. And I think a lot of times people just aren't willing to say, "Hey, I'm struggling."
Yeah. Well, and that's a large problem, because a large event that happened in my life and our life, it was in the other side of the family than Michelle and I, our direct family. But years ago, my brother-in-law died by suicide. And when we were going through that, it was really difficult because we could see the change in him mentally. We could see the struggle. And I remember it very vividly because it was after we moved and we had come back to help mom and dad get everything ready for them to sell our childhood home and move on. And just immediately seeing my brother-in-law and talking to him on the phone in person was just like, what is going on, like something snapped and changed. And we really do believe that he was suffering from a mental illness that was not diagnosed at the time. And to see him spiral and to do things, for example, like call the local police department and them say, there's absolutely nothing you can do, they're an adult. We know these things, but when you're going through it, it's, this huge amount of stress, and you just want them so badly to get help. And it just ultimately doesn't always happen. And in his situation, that whole time we were there, we were trying to get him in for evaluation, in for help. And we won't get into this side of the industry, but there's a lot of disconnects in the way that mental health is handled in the medical industry as well, and in different hospital systems. And once we went back home from that trip, we got what we thought was good news, that he agreed to go to the emergency department for evaluation, all of these things. But still, they're basing their assessment on what he is saying at that time, whether
Mhm.
he's psychotic or not. And
Yeah.
ultimately, they decided, okay, you're not fit for inpatient admission. You can follow up outpatient tomorrow. And that's when, he took his life. So it's really hard to think back, and that's why, earlier this year when I heard that about the physician I was working with, it just takes your breath away,
Yeah.
because you don't know what people are experiencing, and not everybody's going to be showing symptoms like my brother-in-law did. It was very clear that he was in a moment of crisis, but a lot of times we don't even have those symptoms. We don't have anything visually that's cueing us, like, hey, this person's really struggling here.
Mhm. Yeah. And that's really unfortunate and something that I think our workplaces need to do a better job of, just like point blank. I know that they offer different employee assistance programs and things like that, but those are rarely used. And I
Hmm.
think that um there is such a focus on making money, getting the most revenue, that these things are like we're almost like the cost of our mental health is almost like the cost of that, if that makes sense. Like we pay a price, it's not monetary, it's emotional. Sometimes that emotional takes a physical toll. So I think that's conversations people really need to start having. And if you are in a leadership role, I think that things need to be evaluated and you need to start looking at reframing how wins are categorized. You need to start celebrating things other than just that almighty dollar. Oh, we reached our monthly dollar goal. Okay, that's great. You know, celebrate somebody's accuracy or their work on a complex case or, things like that, not just how much value was brought
Hmm.
in without any thought of the person's work that went into bringing that outcome. Like even with physicians and going to work on very complex patients and things, that takes a toll on them. It's not like they're sitting there stone hearted telling this
Hmm.
patient that their prognosis is not good. They feel the effects of that.
Right. Yeah.
But that's not what that's not what is the focus. They go back to their office and have an email waiting from administration asking why their RVUs are down or why are their, number of level 4s out, not matching other providers or below the national average. And it's like, who cares? They just told somebody they have a limited time to live. You know what I
Mm.
mean? Like, give them support for that.
Yeah. Well, and I think that's what we're seeing in the industry in general when we hear about things like residencies being down. Not as many people looking to get into medicine, and it's one of those things where we look at it, and again, I don't want to say we're part of the problem because we didn't create the problem in
No.
the industry, but we're a part of the side of the industry that is very burdensome to our physicians and practitioners. And I think in general, too, if you think about management or if you think about a department that people work within, showing some grace to people, even if it's not something where they're going to say, maybe it's something that you can anticipate. If you know that there's a situation that requires a lot of pressure on a team with a tight deadline, high volume, whatever it may be. Maybe think about the way that you're framing that and also ask yourself, okay, am I joining in on this as a team
Yeah.
player, or am I just sitting here giving directives and not really taking on any of that
Yeah.
burden myself?
Barking out orders and,
Hmm.
cracking the whip, so to say. And not to say that there aren't people with compassion. And yes, we have a job to do. We have to make money to be in business. But I feel like it just has been this shift. It's like it reminds me of my previous career in banking. I thought I was going to be in banking my entire career. I would retire from there. I started as a senior in high school as a teller, just continued on with that full time. And then all of a sudden it became about sales, and it was no longer about that relationship with your patient, or not patient, your client. We don't have patients at the bank. Oh, let's hope we don't have patients at the bank. That would be a bad day. Um, but it became all of this intense sales pressure, and they're like, you're going to have a call night and you're going to call these people with X amount of money in their accounts. And it's like, no, I did not participate in that. I I was there, yes, but it's terrible that I'm saying this, but protecting my own mental health, I would turn my cell phone off and I would call my cell phone repeatedly and leave voicemails and pretend to have conversations with people. I was not calling somebody. It was after business hours, so you had to stay later, and people are getting home from work, trying to get home from work, get dinner done, probably get kids ready for extra curricular activities. Like, that's when I was like,
Hmm.
no, this is a hard stop for me. I am not a born salesperson, and I always was very successful from just forming a relationship with somebody. And when they
Hmm.
had a need, they would come to me because I was their banking person that they trusted. Like, you know what I
Yeah.
mean? So I feel like it's kind of the same concept. If we just did our jobs, provided compassionate care and the services that the patient actually needed and wanted, we probably wouldn't be too far off from where we need to.
Yeah. Well, and let's shift a little bit of focus here to really we can apply this professionally and personally when we think about mental health in general, but being there for other people or trying to talk about it enough, be open enough that someone feels comfortable. And I know in saying that it doesn't mean across the board it's going to be that way for everybody. I've also talked about how in the workplace, that's you're not there to make friends, but sometimes those are the people you're around the most. And it can help to have open conversations or get
Mhm.
input from other people. We talked about that external voice before.
Yeah, I look at those as having, like, instead of calling it a friend, have a peer that you could debrief with, like
Mhm.
somebody who is on the same level as you. So somebody that you trust too, because we all know there's snakes in the team that just can't wait to take the tea everywhere. You know what I mean? Don't go to that person because that's just going to add more headaches. But have that trusted coworker that you can go to and say, okay, this is driving me absolutely crazy, or I am having a hard time making a decision on this. What do you think? And you know that it's a safe space that you can say you're having a hard time, or even say, I just met with so and so and it was really rough. Like,
Mm.
that can help you kind of process that. I know I force Stephanie into that for myself quite a bit. And, I'm like, I just can't, you know, get it out of my head. Or, somebody said this in an email today and I took it this way and it's really frustrating to me.
Mhm.
Like, am I wrong to be frustrated? Do I just need to get over it? Like,
I
you
had
know,
that today. I had 2 different emails, and I'm texting Terry, and I'm like, "Terry, what are your thoughts on this? This is my
yeah.
initial gut reaction here." And, obviously not responding right away to give
Oh,
some space
no.
and time, but yes, having that other insight in general. And, on the personal side too, sometimes if you can't find that at work, you do need to look for it on the personal side. But one thing I will say is that in hindsight, when we look back at what, I've dealt with in our family, or Michelle, you and I have a mutual family member, a cousin that's been through a lot over the past
Mhm.
year. In hindsight, when we're trying to grasp and understand, okay, why did they not say anything? It's one of those things where hopefully people are starting to recognize too, like, hey, maybe if I had had a light bulb moment, that if I was upfront and honest, no matter how difficult it was going to be to face it, that person would never want that situation for me either.
Mhm.
And
Yeah.
with that, over the past year, so actually a year ago this week, we
Mhm.
had a family member who did attempt suicide. And it was something, again, that is very gut wrenching. I remember
Mhm.
when I heard it was just all of this. Why? They did make it through. They're still here with us, which is great. So we've been able to have
Thank
a
God.
lot of conversations
Yes.
around, what the thought process was. Pretty much everything that was left open ended with my brother in law, we had an opportunity now with this family member. And, it's one of those things where when you don't know what you can do for a person, one thing I can say with confidence is that just being there and just being the person for them to lean on, to talk to show up and tell them, like, hey, we're going to get through this, but you're not going to do it alone. Those types of things really make a difference.
Mhm.
And I know
They
that
do.
I've seen that in this situation. I've seen it in my own family where, we've had to go through some pretty dark days. And especially after my brother in law passed, having to navigate that not only through my personal life with my husband, with my daughters who really struggled through that time, but then thinking, okay, now I also have to get through work at the same time and deal with all of these other things going on. And
Mhm.
Michelle, I know when we had this situation with our cousin, just showing up with family, you and
Mhm.
I immediately went up to be with family.
Yeah.
I went to be with her when I was able to, in the process of hospitalization, all of that. She did actually come live with my family and I for really last summer, right?
Yeah.
Last
Yeah.
summer, spring into summer. And, it's just something where you really see firsthand how fragile somebody is, and
Mhm.
how when they are pushed to a point, you think they're a strong person, but you're pushed to a point and you just can't take anymore, or you can't
Yeah.
understand what the future is going to look like.
Yeah. And I think sometimes too, things that lead up to this are really something that's going on up in our brain that
Mhm.
we we don't realize, but this constant stress and this constant, like, I don't know.
Overwhelming
Yeah,
feeling,
like,
like
I wanna say fight or flight mode has a toll on your body. It does things chemically to your brain, and then things become so disordered that you do something desperate, because I
mhm,
really feel like if our family member had been in the right frame of mind and not in this very acute phase that she was in, this would not be what she would have done. And she has done so much work, and
mhm,
it's a terrible thing that we had to go through, that she had to go through, that, I think it was very eye-opening for our family, as a whole, surrounding mental health and trying to understand how this happens, and maybe not always putting on a happy smiley front, that we shouldn't have to do that. Like, if we're not okay, it's okay to say, I'm not okay today. you know
mhm,
I really wish that I could be happy to see you, but I'm struggling with something right now. And I think it helped us realize that, we have real things
mhm,
going on, and we have real struggles that we face. And I'm so proud of our cousin and how far she's come, and I feel like we're finally getting to see a happy, healthy person
mhm.
again. I think she's to
The
that
mask
point,
has come off.
yes, where she is truly embracing her life, and she's happy, truly happy and healthy. Doesn't mean there aren't still hardships or hard times, but we're starting to see that actual happy and healthy come out. And
Mhm.
and that's very rewarding to see, and it makes me very happy to see.
Yeah, and actually this last weekend, she completed, her first 5K, so that was exciting too because to just look back at a year and remember where we were at in the hospital a year ago, not even
Yeah.
sure that she was gonna be with us, fighting, coming through everything physically, then having to fight for herself mentally, and really coming back is the strongest version of herself that she's ever been.
Yeah.
And, when we look back at it from our perspective, again, it's one of those things where I say to myself, and I've said to her many times, if I had known, I would have been there like this years ago.
Mhm.
But not everybody's going to let you in, and not everybody's going to be open to the discussion. Even if you just
Yeah.
think about people who struggle in marriage, we're not going to call each other up and be like, oh, guess how bad my marriage is today. And,
Yeah, like,
all of these
"Oh,
things. Yeah.
this terrible fight happened,"
Yeah.
but,
Yeah.
I think that something that, it really brings to the forefront of my mind, something that I really struggle with on the other side of this is, because I have so much anxiety, I'm
Hmm.
like, "Man, what if this isn't a good time to call and check on them? Man, what if they're gonna be like, 'Oh, I don't wanna talk about it,' or, inconvenienced, or what if they think I'm annoying?" I have all these self-doubt problems,
Hmm.
and I think one of the biggest things you can do is find a way that is comfortable for you. Like, even for me, sometimes sending something as simple as a text message is like,
Yes.
Is this weird?" Yeah, you know what I mean? Like, I really struggle with that personally. So that's, something that I have to work on to be a better support person now. Like,
Mhm.
I don't have those anxieties with with my parents. Even like our sister-in-law, poor Amanda, she gets inundated with our crazy.
Yeah.
We put it on her more than on our brother. But just remember, there's different ways to be there for somebody. It could be as simple as sending, like, send a $10 gift card for Starbucks and say, hey, take some time for yourself, take a break, enjoy a coffee on me, read a book, enjoy a movie, do something
Mhm.
that works for you. You can show up for people in more than just, these grandiose measures and or even
Oh,
like
yeah.
invasive ways. Like you don't have to be like, what's going on with you today? Are you feeling okay mentally? You know what I mean? Like you don't have to be that way. You can just be like, hey, thinking about you today. Hope everything is going well, and I don't know.
Well, and for me, now obviously being through a lot of things, I've learned through experience how to handle things a lot differently, how to have conversations, how to talk about hard things. But one thing that I noticed, and I'll make sure I link it in the comments of this episode on LinkedIn, and I'll put the information in the other podcast platforms as well. But look at different resources out there
Yeah.
and how they help guide you to have the hard conversations or to check in.
Mhm.
Because one of the things that I always struggle with when we think about somebody who has been through a death in the family or a new cancer diagnosis or anything that is going to be absolutely life altering, if you have friends raising teens, check in on your friends. I always joke
Well,
about that. But
not
check in
just
on your
teens,
friends.
not just teens, kids anywhere,
Yeah, that's true. That's true.
because I
They
guarantee
start
you.
young now. They start young. But there's resources out there, and one of them that I really like, it's called SAMHSA. It's a Substance Abuse and Mental Health Services Administration. So they have different things out there that are related to awareness. I would say they have a whole thing for the month of May for mental health awareness, but they put out different toolkits, and they also put out different things where you can learn how to approach a situation. So you can
Oh,
look for
okay.
help for yourself on there if you're struggling. Don't forget that the new number now for crisis, you can call or text 988 for yourself personally, or if you're trying to help another person. But this particular site has all kinds of tools on it and resources to help you learn. I know for myself, dealing with this, we've talked a lot about suicide today, but it's not always to that extreme.
Mhm.
We've been through things like alcoholism in my family, things like that that were really hard to navigate, especially when I don't feel that or I don't cope in that particular way. And
Yeah,
looking at these different resources are going to be huge. And just remember that, people generally, if you're looking in the right places and you're not in a group full of narcissists, people generally want what is best for you.
yeah,
And even if there's poor performance at work or stress at work,
I
if you
know.
were to sit down and have a conversation like, hey, I'm struggling, or reach out to one of those programs you were talking about, Michelle, with the employer that is completely separated out, they truly want you to use that. Think of the different sources out there. If you're not comfortable talking to people that you know directly, there's so many options out there where you don't have to reach out to somebody directly. I personally had a great relationship with a therapist through BetterHelp, which is a national platform. There's a lot of different behavioral health organizations out there now where we have that convenience factor, right? You
Yeah,
don't have to go in person. Sometimes people are afraid to seek out therapy because it can be awkward if you don't like the therapist and you have to, break away. Some of these other platforms, I did it for convenience and schedule, and some of it was during COVID, so that made a big difference. But you can also think about things like that. If you need to break up with a therapist, they will help you, get in touch with another one and you never have to see that one again. There's none of
yeah,
those awkward situations. There's always going to be help out there. Make sure you're taking care of yourself first as well, because in order to be able to support other people, you've got to be in a good place too,
Mhm.
or it's just going to drain you. And that's been some of my experience over the years. That's why I feel like I was in such a good place. And even my husband and my family, we were in a much better place to help my cousin last year, take her in,
Mhm.
find her good programs, get her through recovery, get her on her feet. And I don't know that, I mean, obviously we would have wanted to do that for her before, but I don't know that we would have been as emotionally available if we didn't put in
Yeah.
hard work on ourselves first.
Yeah, definitely. Agree with that. Get focus on yourself so that you can also put, put time into other people as well when needed.
Yeah.
And it's okay to say, I can't do this. Like recently, even it wasn't just saying, I have to take a little break from doing the podcast. I even, had to say to my employer, look, this is what's going on. I'm really having a hard time just even doing daily things. um
Mhm.
I was also working towards, getting things with my health figured out. You also have to do the work on your part as well. But
Mhm.
people people are more willing to give you grace than you think, and give you the time you need, so that, like, I can't imagine where I would be if I, was dealing with this illness that kind of came out of nowhere, dealing with this sudden onset here and trying to still do life as normal. Like,
Mhm.
I did go through that phase with, why am I being so lazy? Why can't I be like a normal person and get out of bed and just go about my day? Uh, you go through those phases, but speak up when
Mhm.
you're struggling. There, you don't have to, life doesn't have to be hard, and there are ways to do things so that you don't struggle so much. And that's, I think, what I wish more people would recognize. You don't have to struggle. You can enjoy life, whether that is going to be medication to help you do that, whether it's going to be boundary setting. That can be
Mhm.
huge when it comes to mental health. That's something I am big on, is setting boundaries for myself to say, nope, this is not, this is expensive to have
Yeah.
space up here. It's expensive to take up space in my brain. And I am very particular about what I allow to take
Yeah.
up space there. So, set those boundaries, seek the help, whether it be counseling or medical help.
Yeah. Well, and I know too that a lot of times it can seem very overwhelming, especially if you're in a toxic situation or a toxic relationship, things like that. So my advice after going through so much would be to start with therapy, because sometimes it, well, for me, the medication part, what I was just being neurotic about it, and I
Yeah.
really needed other input on that part of it. But talking with a therapist and the prodding of Michelle really helped me to understand, okay, these are the things you're experiencing. You're not processing this in a way that is healthy.
Mhm.
And, having that input that can really help. It's not as invasive of a way to start your
Mhm.
treatment. What's it going to hurt? Like I said, reach out to an organization that's telehealth, that's national, have some conversations. It doesn't mean that because you sign up for a therapy session this week that you are now in therapy for 3 years. Have some conversations, feel it out, see what it feels like to you. Maybe you need a different type of therapist if one that you're working with doesn't feel like you have a connection, like it's helping. And, think small steps, don't think big picture first. And I really hope this particular episode shed some light on just in general, thoughts on mental health. I know there's a lot of people out there that still think about this as something that should be kept hush hush, that you shouldn't be talking about. Like I said, some people may say, "Oh, well, that's not a professional type of conversation," but it's reality, it's
It
life.
is.
And
It's it's a reality that I struggle with anxiety that can be crippling, and it is a professional problem when that
mhm,
anxiety leads me to not being able to effectively get my work done, or it taking me 3 times as long because I can't make that decision. It is a professional problem,
mhm.
and, it's a it's not, it's not bad.
It's a
Like,
yeah. Well, and it's an
it's
illness. It's
okay
one
to
of
recognize.
Yeah, it's one of those things where if we broke a bone or we had, part of our leg amputated, that's going to be looked at as something very serious. This is just as serious. This is
Mhm,
an illness. You need support, you need treatment, and look to, get that for yourself. Look at how you can support other people when you know you're going through things. And hopefully, you can start to have conversations like we're having here. It's going to be a focus, throughout. You can tell we've been very open up to this point. It's going to be a strong focus in May. Going forward, the other episodes, what we're going to do is we're going to switch gears and we're going to talk about different coding and billing situations because I do work a lot with different practices, telehealth organizations, facilities, substance use disorder clinics, all of these different organizations, and there's a lot of common threads in the areas of errors that we see from a coding and billing perspective.
mhm,
But I
yeah,
didn't want to just jump into that right away this month. I thought it was really important, again, as a personal goal, to just continue these public conversations, get it out there, start talking, and let's break that stigma as much as we can, a little bit
mhm,
at a time.
absolutely.
All right. So I hope you all have a good rest of your week and give it some thought. Think about it through the month of May. Look at the different sources that I'll put out there. I'll be posting throughout the month as well on LinkedIn mainly and on Facebook on the page there. But give it some thought. Think more openly and broadly. Look at yourself, look at others around you, and look to see where you can make a difference or you can start to change things that you know that you need help with as well.
Mhm.
All right, we will see everybody back next week.